All right, we're recording. Let me switch over. Whoops, I need to share that first, don't I? Hang on one second. There we go. Good evening, and thank you all for showing up tonight. We're so happy to see you here. As usual, Dawn is going to read our little FDA disclaimer. This is a disclaimer for any natural product that you might talk about publicly. So go ahead, Dawn.
Yes, because we are talking about a natural solution to our topic tonight is diabetes. Our disclaimer says these statements have not been evaluated by the Food and Drug Administrations. Any products are not intended to diagnose, treat, cure, or prevent any disease. This presentation is not intended to provide diagnosis, treatment, or medical advice. Products, services, information, and other content provided in this presentation, including information that may be provided in this presentation directly or by linking to third-party websites, are provided for informational purposes only. Please consult with a physician or healthcare professional to get further assistance. And we would like to remind you to please like, share, and subscribe. The information here may help somebody that you know. And David, diabetes and glutathione is the subject. So I'm going to go ahead and let you take it over until the end.
All right. And we actually have a kind of a special entry in our science part of the presentation today. Diabetes and glutathione is, if you go to any of the medical document repositories and put in diabetes and glutathione, you're going to come up with so many articles on this subject. We're dealing with diabetes, and a lot of people have diabetes these days. And it goes back to the pancreas. And I learned something about the pancreas. I didn't know that it was connected with the bile duct and dumps directly into the small intestine. Now I do. And as a result of that, if you have gallstones, you might be clogging up your liver, gallbladder, and pancreas all at the same time. If, as this illustration shows, the gallstones get stuck at the bottom of that bile duct just before it empties into the small intestine, you could have some major problems with gallstones backing up these three organs. And it does cause a lot of issues. So I didn't finish changing this slide, but in 1946, there was one article on glutathione related to diabetes. 1991, there were 16. It kind of plateaued for a few years there in the tens. But in 92, interest kind of spiked. There were 45 articles written in 92, and last year alone 487 articles on diabetes and glutathione, not eyes and glutathione. And you see our little glutathione molecule here. There's 3 different amino acids, and the blues you see here are the connections between those 3 amino acids. And the really critical one is the one in the middle. This is cysteine, and that yellow on there is sulfur. That is the magic of glutathione. That's what makes everything work, is that little sulfur molecule there. Um, in dealing with the pancreas and diabetes, there's only a few things that I came up with, diseases related to the pancreas. Pancreatitis, which is inflammation, could be caused by all kinds of different things. Cholangitis also is inflammation, but it's a little bit different than pancreatitis. And then the cholecystitis is inflammation that actually stems from the gallbladder. And then you have the gallstones, diabetes, and pancreatic cancer. But we're talking about diabetes, and on the right side, you see some of the complications of diabetes: heart disease, nerve damage, kidney disease, eye damage, all kinds of skin conditions, slow healing if you get injuries or have surgery, hearing impairment, elevated oxidative stress, and this is a really huge hallmark, sleep apnea, and eventually dementia. So diabetes is nothing to be toyed with. So the question is, what can glutathione do for diabetes? And this is that study I mentioned. Cysteine and cysteine-rich undenatured whey protein supplement, aka ImmunoCal. And we'll talk about that here in a minute. In patients' pressure ulcers outcomes, an open label study. So the patients knew that they were taking ImmunoCal. And the abstract on this is rather long, and that's kind of because of the folks who wrote this. Dr. Gutman likes to be very, very detailed, and I haven't met Dr. Conshaven, but I'm sure that considering the work that she has done on undenatured protein complexes, I'm sure she's very, very detailed as well. So I pared that down to the results and the conclusion. They took a total of 10 patients. These 10 patients had 23 pressure ulcers between them. And in 3 months, just 3 months, 44% of the pressure ulcers resolved. Now, what's a pressure ulcer? It's bed sores. Bed sores because these patients had severe diabetes. They were mostly confined to bed or a wheelchair, so they had bed sores. 44% of these resolved in only 3 months, and 83% had better than 75% resolution in only 2 months. And that from not responding at all or just getting worse from the treatments that they had been on. So the doctor's conclusion: by providing the necessary amino acids to rebuild tissues and the bioactive cysteine to promote synthesis of intracellular, and that's important, intracellular glutathione, and the positive nitrogen balance that this gives you an improvement in pressure ulcer healing. And this is, of course, just one aspect of what glutathione can do for diabetes patients. So we can see here that the slow healing was definitely resolved. The oxidative stress was also helped quite a bit, because that's why you get pressure ulcers, is you have excessive oxidative stress. It's not just that you're in one position all the time, though that is a huge contributing factor. Without the oxidative stress, then your skin doesn't break down the way it would with diabetes and the pressure ulcers. So here's another study that we came up with, effects of oral liposomal glutathione in altering the immune response. And this was in individuals with type 2 diabetes. Excuse me. And what they were looking at, it's in the abstract, they did, this was a double-blind placebo-controlled study with people with type 2 diabetes. And they wanted to see what the therapeutic effects of increasing their glutathione level was. And they used oral glutathione, which is not the best way to do it. We'll show you that here in just a moment. But even with a supplement that was not ideal, their conclusion is that in 3 months, again, this was a 3-month study, the patients were able to maintain their glutathione levels, reduce their oxidative stress, and reduce their bacterial burden at the same time. So this was a huge thing. And they also showed modulation in the levels of cytokines. And that is another major thing with diabetes and other disease conditions, is when you get inflammation, it winds up causing cytokine storms, which makes the inflammation worse. And this shows that the glutathione modulated those cytokines and prevented the cytokine storms, so reducing inflammation at the same time. Our next study is very similar, a 3-week study on oral glutathione, and they wanted to see what the effect would be on whole body insulin sensitivity. And they specifically took obese or overweight men who had type 2 diabetes. And they found that, again, oxidative stress was relieved. It increased significantly the insulin sensitivity. So that's reversing your diabetes, right? Because diabetes is insulin resistance. So by increasing the glutathione level, they increased insulin sensitivity. And they also increased the glutathione level and skeletal muscle. They measured it at about 19% increase. And their conclusion was that it does improve insulin sensitivity in these obese subjects, but it did not alter oxidative stress markers. And that's an important thing because they were using oral glutathione supplementation. And here again is our glutathione molecule, the tripeptide, glutamine, cysteine, and glycine, the 3 amino acids that make up glutathione. So you see, this is a huge molecule. And we read an article, pulled out part of it from exam.com. And examine.com, they do just that. They examine scientific papers that have been studied. And they note that glutathione is critical for a number of processes in the body, all the way from being just a antioxidant, though it's the master antioxidant. I say just an antioxidant, all the way to being critical for energy production and hormone synthesis. These studies and exam.com noted that supplementation of glutathione Even though it's thought to support the pool of glutathione in your cell, it doesn't, because the intact glutathione molecule cannot enter the cell. It has to be made within the cell. So these 3 amino acids have to enter the cell, and the cell has to synthesize the glutathione from those. But it also needs all the cofactors that go with it. And that's where this little product here comes in. ImmunoCal, glutathione precursors. With over 45 years of research, well over 400 scientific research articles written specifically on ImmunoCal, one of which we showed you there, and 80 patents worldwide. This whey protein isolate is a bonded cysteine, so it has the 2 critical cysteine atoms or molecules, but they're contained in a shell of other proteins and amino acids. And these are all the other cofactors, including glutamine and glycine, that are needed to create and use glutathione inside the cell. So your intracellular glutathione is raised. And that's the critical part about ImmunoCal. That's why this is such a fantastic product, because it's the only one that does this. It's the only one with this whole complex that not only raises your glutathione level, but gives your body everything it needs to actually use the glutathione in all the different metabolic processes that it needs to.
So if somebody was to just go out to like GNC or a vitamin store and find a glutathione supplement, they're not going to get these results that we're talking about, the most benefit.
That's correct.
Can you explain when you take ImmunoCal what it does that's so special, and why this works better when it comes to surviving the stomach?
Okay. Well, when you take an oral supplement like they were using in these studies, the glutathione gets into the stomach, but then the stomach acids and the enzymes in the stomach break down the glutathione into its component molecules. And so for your body to use glutathione, it has to take all these component molecules, transport them to the cell, and reconstruct that entire chain, reconstruct the amino acids, reconstruct the connections, and then it has to construct all of the cofactors that it needs to use the glutathione. And that's true also of other supplements like NAC, N-acetylcysteine, which is a synthetic cysteine. Some of that does survive the stomach acids, but not a whole lot of it. So I think the estimate, I'll get the exact estimates for next week, but the estimate is something like, I think it was like 15% of the N-acetylcysteine that you take actually gets to your cells.
And then there's a lot of cost involved as well, because
yes,
I've actually had that before we learned about ImmunoCal, and it was like $100 and some a IV bag.
Well, you were taking the IV cysteine, and that's expensive because you have to have a doctor do it. It's invasive because it is an IV. It does bypass the stomach, but again, when you're getting a glutathione drip that way, it's not getting into your cells. With ImmunoCal, that shell of proteins and amino acids the way it's constructed, it's a natural form derived from milk, cow's milk, that gets it through the digestive process intact. So your stomach acids and enzymes aren't breaking it down into its component molecules. It's making it through your digestive tract into your bloodstream intact, makes it to your cells, and then the cells have special enzymes. And their job, their only job, is to deconstruct this shell, take the components, and like Legos, put your glutathione together. A very simple process. And then that goes into your cell with all the other cofactors, and it's used for your mitochondria to clean them up, to assist in production of energy, the ATP, that is the chemical that runs your body, assists in repairing DNA, assists in creating enzymes and everything else.
We're at the end of our time. That would be a great subject to go over on another presentation. So we'd like to thank you guys for enjoying us. Did you have anything else to say in part before we leave?
No, that's it. But I do think I will, if you're up to it, I will try to pare all that information down into a short presentation.
I would love that, because this was a really good presentation. I really enjoyed it. And we want to make sure that people do click below so you can see more about what we do and how to contact us. David, can you go ahead and give them our website and contact information? Again, they can look below, but I always like to say it as well, because we are the Meta-C.
Yep, it'll all be down below. There's a lot of information, so click on more so you get to read it all. Our website is themetaf.org, and that's our former initials, THEMETAF.org. And you can reach us at info@themetaf.org. And please, of course, like and subscribe, and we will see you next time.
I also would like to say, if they would like more information about Munical, we have a team that we've been working with that are eager to